we're talking about obesity, but really morbid obesity is the major health problem. So morbid obesity is defined as a level of obesity where other medical problems start to happen. And those medical problems are what put people at medical risk over the course of their lives. And that's the justification for doing something like placing a balloon in your stomach with a procedure or having an operation. There we go. Okay. So when we talk about obesity in the United States or internationally, we define it by the body mass index. And it's sort of a measure, it's a relationship of the weight to the body surface area. It's supposed to be a better number than just throwing out the weight, because you could have a male who's 6'6", who weighs 300 pounds, and that's not really that out of bounds for him. But obviously a female who's 5'2" and weighs 300 pounds, that's a really different story from the terms of risk. So normal weight is considered to be 20 to 25. In reality, most Americans are overweight. They're in the 25 to 30 range. Obese is defined as having a BMI greater than 30. And then morbidly obese, where the medical problems start to accumulate, more at 35 or 40. And then super obese, which is not to be pejorative, but super obesity is a high-risk category, and anyone with a body mass index over 50 is really looking at significant risk for the future from a medical standpoint. Obesity causes a variety of other medical problems, and probably because the biochemistry suggests now that fat cells by themselves elaborate chemicals that get the body stirred up into an inflammatory state. And some of these disease processes come from that. There's also a concept now of lipotoxicity, and that's where the fat starts to accumulate in cells other than fat cells, so liver cells, for example, or heart cells, and that affects the function of those organs. So obesity is not a benign problem. Carrying around the extra fat is not just a self-image issue. It really does cause medical problem, medical dysfunction. If we look at, here are just a number of things that obesity leads to. Surprisingly, and now well proven, is cancer is more likely to occur if you're significantly overweight, particularly breast cancer and colon cancer and other forms of cancer. These first 6 things on the list, though, are all independent risk factors for heart disease, for hardening of the arteries, for strokes and heart attacks. 1 in 5 Americans dies from a heart attack, and 1 in 7 dies from a stroke. So these are risk factors for that, and that's why obesity is commonly the root problem for those issues. And that's why we're seeing increased number of patients in the United States with diabetes, and therefore and high blood pressure and high cholesterol, and that leads to more heart attacks and strokes and increased healthcare costs. So if you look at the United States, the percentage of population that's obese varies from state to state. Usually West Virginia and Mississippi are kind of fighting it out for who's the biggest state. Colorado is probably the healthiest state. Texas is about 10th. So we have a 30.9% obesity rate. That's very large. Our population's 25.6 million, so that's over 10 million people that are materially affected by this. The cost is tremendous. 147 billion, 210 billion direct costs. People missing work probably adds another 4.3 billion in costs to that, and then people who are at work but not productive because of limitations from their weight probably also contribute to decreased productivity and is a financial strain. Individually, heavy people pay more for their health care. They pay it directly, indirectly, or someone else pays it, but they spend about 42% more than an average person or a normal weight person. Even patients who are moderately obese, not considered morbidly obese, end up being placed on medications more commonly, which suggests that they really are morbidly obese. It's just earlier in the spectrum than the end-stage obesity with the major medical problems.